From the mountain to the ocean, from the windward to the leeward side.
Aloha.
Aloha.
All right, and welcome back. You're watching Rise Above Hawaii, which is a 30-minute talk story on health, and we talk about everything and anything. But I'm real fortunate and happy to have Dr. Sally Boyd here, who is naturopathy, or how would you?
I'm a licensed naturopathic physician in the state of Hawaii. Yes.
Licensed naturopathic physician. So let's talk a little bit about that. I know off camera we were talking about, because she says, so Kim, what do you do? I'm a psychologist, and she's a naturopathic physician, and I think we're kind of the underdogs in our field.
Yeah.
Because I you know, like in my field, the psychiatrists, are here, and what's funny is the psychiatrists feel like the underdog to the MDs.
Yeah.
You know, so there seems to be a hierarchy.
Yeah. Well, medical politics is a huge discussion in the U.S. Just in general, in terms of who thinks who has more training, and a lot of it just comes of lack of education.
Yeah.
So there's only about 5,000 to 10,000 naturopathic physicians in the whole country, versus over 500,000 MDs. So we're like a profession right here, and the MDs are right here. And so 99% of Americans don't even know what a naturopathic physician is. And they don't know that the trainings are actually equivalent, that the exact same number of years of medical school go into a naturopathic doctor as a medical doctor. Over 4,000 hours of education, for example, 3 days of board exams or more, residencies, all those things naturopaths also do if we're from a real accredited medical school. So most people have no idea.
That's incredible. And how I got Dr. Sally on board was a family friend of mine keep just telling me how wonderful her experiences are with Dr. Boyd. And so finally I was like, okay, what's her number? Go find her number. I need to get her on my show, because I think people need choices. Folks need choices out there. And she's been to various doctors and specialists, and one specialist she went to, she's like, I had to fly all the way to Oahu chemo for this specialist, and he only talked to me for a minute. 1 minute.
Right, and that's not his fault, by the way. That's the way the medical system is structured. It's actually structured to the detriment of the doctor. You have to understand that even to go to medical school, regular medical school, my medical school, your PhD program, it's a huge commitment in terms of time and energy and effort. I mean, these are doctors in general are very caring people. The system that they're put into suppresses a lot of their ability. The average MD in this country has 7 minutes with their patient, from start to finish. So you might be in that office for an hour. How long do you actually see the doctor? You see the nurse, you get your blood pressure taken, you get your charting done by some person. But how much can you actually heal in 7 minutes?
Yeah, that's true. Okay, so I like that take. I never thought it's not. I always thought it's their fault.
It's not like this. It shouldn't be like this. It should be about how can I help? Here's my training. Here's your training. What's the best thing for that patient?
Yeah.
What does that person need? And a lot of times they do better with alternative care and conventional care together. Because I have a whole huge bag of tricks that I learned that come from eclectic herbal traditions all around the world, and I pick the best of all that, and that's what I have to offer. I'm not going to be doing surgery on that person. That's not what I do best. That's not what I offer. So I like to look at people and go, what do you need, and get my ego out of the way.
I think the ego sneaks in there every once in a while.
Well, it's fear. It's like they're afraid we're going to take their patients, or we're afraid they're going to put us down, or all that stuff. Yeah. And the more we get out of the way of that, the more the people get better.
I like that. Okay, so I like also the idea that it's not their fault, that somehow the structure has given them only 7 minutes.
Yes.
Maybe.
Yes, so. And a lot of their education, especially medical professions, continuing education is funded by drug companies. Yeah.
Oh, so
then we start getting into some sticky politics. Because if somebody's funding your continuing ed and paying for all the snacks at your table at your conference, or flying you to the Bahamas for your continuing ed, you're going to be influenced by what they want you to do, which is sell their drugs.
Sell their drugs, use their medication.
Right. And that's just human nature. I mean, you know that more than anybody else.
Yeah, that's true. Yeah.
So we try, as naturopaths, we try to stay out of that. We try to make sure our training is not funded by someone who wants to sell something through us. Yeah. But sometimes that would slip in with an herbal company, too. We have to watch that tendency in our profession as well.
Yeah. You don't owe nobody nothing.
That'd be nice.
That's like politics.
Yeah, that'd be nice.
Special interest groups.
Yeah. But I try to separate the politics from the individual. The MDs that I meet on this island are curious. They're typically really open to what I do. If I have a suggestion about a patient, or I write an MD a letter saying, hey, I got to see this person for an hour, you know, and I found all these cool things that are interesting things in their history that you didn't have time to find out. What do you think about this therapy or this therapy? I almost always get a good response. Like, oh, thank you for finding that out. Oh, that's a great idea. Try that herb. Try that you know, mineral. Let me know what happens.
Yeah.
I have never gotten. I mean, Hawaii is amazing that way. How open-minded people are.
Yeah, you know, the friend, one of the things they shared with me was when they met with you, it's like, you know, it's so many things. I felt like I was getting an education, you know, and she was saying how, you know, like I get up in the morning, I'm tired, and she said, well, you know, something about, you know, and then there's something about the intake, what she takes before she sleeps, and how the body works against some minerals sometimes, and with some minerals sometimes. And she's talking about vitamin C and how it competes with sugar. And I was like, whoa, so many cool things. And she left feeling empowered. Would you like to share a little bit about that?
Mostly what I come across is how to not give people too much information too fast.
Oh, okay.
So they go, oh, I cannot, you know.
Yeah.
So, but I brought this.
Okay.
Here's our principles
Oh,
of
okay.
naturopathic medicine, and it's sort of how we organize our thoughts and how we differ a little bit from conventional medicine.
Can we zoom up on that
I don't know
real
if you
quick?
can see this.
Yeah.
I think calligraphy is really pretty. But the main one here that I like is docere, which is Latin. I mean, sometimes people use Latin to try and sound more important. But, so docere just is the root word for doctor.
Oh.
And in the old language, docere meant education or educator or teacher.
Oh.
So we see ourselves as doctors as educating people. Okay. And education is empowering, because if you have the right information about, you know, what food is good for your condition, what food is toxic for your condition, just start there.
Yeah.
You know, that's empowering. Someone can then take that and make good choices for themselves about
so
their health.
education is empowering.
Yes.
So
Yes.
that's, but the 7 minutes you cannot give the education.
Not very much.
So-
You can maybe give a handout. Most people don't read
Yeah.
handouts.
Oh,
You know.
so your time with people is more than 7 minutes then.
Well, my first visit with someone is usually an hour and a half.
Wow.
With one-on-one, just with me, and we go through their whole history. We go through their condition, their past history, what they eat, you know, how they sleep. Just because it's all, there's another principle here, which is treat the whole person. Right?
Treat the whole person.
Treat the whole person.
What does that mean? People say that, but what does it really mean?
There's lip service,
Okay.
yeah. But what it really means is that everything's connected to everything else. If you're not sleeping, if you're, you know, as a
That's
psychologist,
true.
if someone's sleeping 3 or 4 hours a night,
Yeah.
they're gonna have
It's hard.
irritability the next day. And I don't care how good their family structure is or their food is. If you're sleeping 3 or 4 hours a night, you're gonna be grumpy the next day.
Yeah.
You're gonna be groggy. It's gonna be someone who slept 3 hours the night before driving. They've done studies that show that it's like having 2 or 3 glasses of alcohol.
Wow.
And they're actually a danger.
So sleep's
Sleep's
important.
huge. So we do a sleep intake.
Oh,
for
hey,
them.
another thing I want to share with the audience real quick is the sleep. Like another piece of information I think is helpful is tell us about how sleep, like the real healing, happens at like deep sleep.
How long can I go on about that? Oh my gosh. Yes, sleep is so important, and it's not just how long you sleep. Which is why sleep drugs are maybe helpful short term, but they can actually be damaging long term, because there's cycles in sleep. So most people will sleep typically 3.5 to 4 hours in a cycle, and then they'll wake up, and a lot of times that's when you might go to the bathroom.
Yeah.
You know, you wake up, stretch, you go to the bathroom, then go back to bed for another 3.5 to 4 hours. That's considered pretty healthy.
Okay.
If you're not doing that, you're not creating the right hormones in the brain and the body. There's a certain cascade of hormones that have to happen overnight to stimulate healing in the rest of the tissues. So, for example, you might have heard of cortisol.
Yeah.
Okay, stress hormone.
Yeah.
Typically, we'll just say stress hormones.
Yeah.
You have to, here, this is so cool.
Yeah.
So, like around 10 o'clock at night, put this down.
Yeah.
Okay, so let me back up a little bit. We're basically fight or flight creatures.
Okay.
So we kind of have 2 nervous systems.
Okay.
We have rest, repair, eat food, nurse your baby, sit around in the tribal fire and hang out.
Yeah.
That's called parasympathetic.
Yeah.
And that's one type of nervous system that we activate. The other one is sympathetic, which you don't have to remember those words. Sympathetic means, oh, saber-tooth tiger chasing me. Okay, the other tribe coming after me with a spear.
Yeah.
I'm going to run.
Yeah,
Right? I'm
yeah.
going to run. There's 2 different types of nervous systems.
Okay.
So in Western culture, in American culture, where are we stuck? We're stuck over here.
Go.
Go. Right, got to get to the radio studio on time.
We call that type A personality.
Type A. We have type A culture.
Yeah, we do.
Okay, when we get stuck in that system, all the things that we needed to do over here, digest our food, heal our bodies, reduce our stress load, reduce our mental stress. That never gets tapped in. Okay, so people are trying to go to bed and sleep and get their 8 hours of sleep, but they're still in this mode.
They're still in
oh
the
my
mode.
gosh, my taxes. Oh my gosh, tomorrow at work. Oh my gosh, oh
They
my
don't know
gosh.
how to get good sleep.
Yeah.
That's
yeah.
me sometimes.
Well, yeah, it's everybody.
Thinking about the next day and
Right.
what happened before.
Yeah,
And
exactly. So what we do is work
Okay.
with people without drugs to help them go from this nervous system, right over here, to this one, right over here. Once you do that, this is another principle, which is the healing power of nature, which is remove the obstacles to cure. So the body, if we allow it to go into this calm parasympathetic state, will heal itself. It'll make the right hormones at the right time. It'll stimulate growth hormone, which is like the fountain of youth. It will relieve anxiety and depression. Your body will do those things on its own if we can get it in the right phase
in
at
the right
time.
place.
Yeah.
Wow.
So we are all about what
love
are the
that.
obstacles to cure? How do we get rid of those obstacles? And then your body is an amazing, your body's a miracle from God. Your body's an amazing thing that can heal itself if we unblock it.
Wow.
So we're all about
Hey,
regulating stuff like that.
that is worth the show right there. We can stop right now, but no, we got another 15 minutes, so hold on.
Yeah.
I love that. I love that.
Yeah.
Gee, so why is it then that why can't we have more of you? You know, more doctors who have that perspective.
Well, there's amazing things happening in medicine. There's more and more people interested in what we call integrated medicine.
Integrated
which
medicine.
is a really
okay.
exciting thing, which is where a lot of MDs that have this really amazing technical training and know all this very technical drug stuff, they learn all that and they're still hungry for the principles, which these medical principles go back way beyond drugs and surgery, way beyond hospitals and all that stuff. And we want those things, and we want the best of the best.
Okay.
Being who we are, we want the best of this philosophy and this
Yeah,
training,
yeah.
and we want to have access to hospitals and surgery and drugs, because sometimes drugs are necessary. Sometimes they're
So
life-saving.
you're not anti-medical.
Oh gosh, no.
Yeah.
Absolutely not.
We're very much we
Right.
need everybody.
Right.
integrated.
Naturopaths are trained to be primary care. So you know what primary care means. It means
Yeah.
you got a cold, you come in, you see the doctor, you get a prescription. Sometimes my prescription will be these herbs, and take the day off. Whatever it is.
Yeah.
Versus, an MD's prescription might be, here, go take this antibiotic right away. So we differ a little bit in the way we do our healing.
It sounds a little bit like la'au lapa'au.
Yes.
Like in the Hawaiian culture, we have, like if we have some sores in our mouths, we take the kukui, or like there's certain things we can do.
Right, and I actually brought you this.
Oh, what's that?
Mamake, right?
Oh yeah.
Yay.
Yeah. Now, there's some healing benefits in this mamake tea, you guys.
Yes, and we don't learn a lot about Hawaiian herbs in West, because naturopaths are Western eclectic medical trained. So we learn herbal traditions mostly from Europe and America, the mainland. But what we also, those of us that are curious, or go, what's an amazing about Hawaiian herbs that we can use? So we start incorporating. So mamake is one that I use, and I don't know a lot about it. There's layers, of education. But for example, for someone with a stomach ache or stress, I would send them home with some mamake. Say, hey, drink this in the morning. Try get off your coffee. Try drink this in the morning instead, or try to slowly, gradually
Transition.
This.
Yeah. In fact, the person that's seen you actually has stopped smoking. Now, because smoking can cause other problems.
Oh, smoking is one of the number one killers in the country.
Wow.
Oh, yeah.
Yeah. So sometimes, even if our body has its own natural tendency to heal, there are things that we do that hinder its healing.
Right. Obstacles to cure.
Obstacles to cure.
Right?
Yeah.
How are your lungs going to be healthy if you keep putting tar in there?
Yeah.
They're struggling to remove the tar instead of getting you enough oxygen.
Yeah.
So, but on the other hand, if someone is using smoking to relieve emotional stress, and I go in and say, you stop smoking, they're not going to do it.
Yeah.
They're going to go, Dr. Sally. I know can.
Yeah,
right?
I know can.
It's not going to
Yeah,
work for me.
because I'm going to stress out. I might kill myself or
Exactly.
something.
So the way naturopaths work is if someone's got a broken leg,
Yeah.
we don't go, oh, your crutch is bad, and yank your crutch away. Have you limp around the room?
Yeah.
We go, how can we heal that broken bone? You don't need that crutch anymore. We gently take it away.
I see.
That's the way it works.
That's nice.
So it's not as scary as someone's not going to come to me, and I'm not going to sit there and say, stop smoking, stop drinking, stop eating sugar. I'm going to say, things are blocking your health and wellness. How can I help you move away from them in a way that feels good to you?
Yeah, and replace it with something that is more healthy.
Exactly.
Oh.
Yeah.
So naturopaths. What is a homeopath? Homeopath. What is
Oh,
that?
that's okay.
Is that the same thing?
No, and that I get that question all the time. Homeopathy is a type of medicine. It's one of the things that we use. So I have a tool bag.
Okay.
I have a big bag of tricks.
Okay,
I call it medical magic. I have this bag of medical magic things I rummage around and go, oh, this would be great for you. That'd be great for you. Homeopathy is one of the tools I can grab.
Oh. Is that like home remedies kind? Where did they get the term from?
Homeo means like, similar, like here's.
Oh, okay.
Okay. So an example of that philosophy would be vaccines. MDs use a homeopathic philosophy when they give vaccines. Okay. So let's say you have a virus that causes pneumonia. Okay. And you go, I don't want to get pneumonia. You give that person a tiny little bit of inactivated pneumonia virus, shoot it into them. Their body goes, I don't want pneumonia. Oh, I've got pneumonia. And it stimulates your immune system to fight pneumonia.
Oh,
right?
yeah, that's how the vaccines work.
Right.
Wow, they give you a little bit of that issue.
They give you a little to wake your body up and go, oh, let's prevent that. Let's
okay,
treat that.
yeah.
So then you go to a nursery school or whatever, and a bunch of kids got pneumonia. Your body recognizes that and goes, I'm not going to get that.
Yeah,
right?
and they get the skills to fight it off already.
Exactly.
Wow.
Okay.
Hey, I like
So
this guy.
That's
I wish he was my
philosophy.
kind of biology teacher. I would have passed
It was
that
fun.
class.
Yeah, it was fun. So that's how. So homeopathy is it takes that philosophy and it just goes into.
Okay, but it's only one bag of tricks.
Right.
Oh.
And some naturopathic doctors use a lot of homeopathy. Some use very little. It's not one of the one I use very little relatively to some other naturopaths.
How about vitamins? Is that like medication or what's the difference?
There's different ways to use vitamins.
Oh.
There's diseases that people get from vitamin deficiencies,
Okay.
which MDs and NDs agree on that. So there's this thing called beriberi, which is one of the first vitamin deficiencies, which is a B vitamin deficiency. And they found it in Asia in chickens. When they started giving them white rice, they started like falling over.
Wow.
So beriberi translated literally means I can't get up. I'm exhausted. And so deficiency
Like
of
fatigue.
horrible fatigue.
Wow.
So the chickens are just flopping over.
Because they eat too much rice.
They eat too much white rice.
That feel like us, you guys.
White
Hawaii
rice
guys, we
sounds
love
good.
white rice, and
Yeah.
they call them
Brown
Hawaiian
rice.
paralysis.
Well, Polynesian paralysis,
Yeah.
the hammock syndrome.
Yeah.
I don't think that's just white rice. But well, in this case, though, they gave these chickens brown rice, and they got better. They got up, they started laying eggs, they started walking around.
Wow.
So they figured there's something taken out. When we took that brown part off the rice, we took something away that those chickens needed to survive.
Oh.
That's kind of how vitamins were discovered in a way.
Oh, that's how vitamins.
Yeah. So then they just, scientists doing this, they went and they found, oh, that's the molecule. And we give that molecule, the chickens get better. That's how vitamins were kind of discovered. So MDs and NDs both agree if you have a vitamin deficiency, it can cause these disease states.
I see.
Right?
I see.
So naturopaths, because we look at prevention and we look at how we want people to thrive versus just not show a disease state.
Yeah.
We're looking at optimal wellness. We want people to be like super happy, super healthy.
Go.
Go,
Like
right?
Dr. Sally got a lot of energy.
Got a lot of energy.
Man.
Right.
Woo.
No caffeine. No. Right. So we're looking for that. That's our goal for people.
Okay.
Versus MDs more oriented towards, well, I don't see any disease state in your lab work. You look okay to me.
Oh,
Back
so
when you're really
symptom
sick.
based, like, oh, no symptoms, you're good.
Exactly.
But just because you know most symptoms, that doesn't mean
Right.
you might be good, huh?
Right. Or we look at a subtle symptom like, well, you don't have scurvy. You know what scurvy is, what sailors used to get?
Oh, yeah.
And it can kill you. It causes
Yeah.
bloody gums, causes bloody stool. It's nasty.
Yeah.
Scurvy, just vitamin C deficiency can kill someone, right?
Oh, it's a vitamin C
Vitamin
deficiency,
C deficiency
scurvy.
causes a disease called scurvy that sailors used to get.
Oh.
Now, I don't think Hawaiian sailors got it. I think Hawaiian sailors were really smart in a way, and they carried food with them that
Yeah.
prevented scurvy because they knew kind of on a core level.
Yeah.
But Western sailors would often lose all their teeth. They'd come into port, they wouldn't have any more teeth because...
Do you have patients that are vitamin C deficient with all the orange juice and everything that we have?
Yeah.
Still yet?
Well, yet. They're not so bad. This is where I'm going.
Oh.
Like an MD would say you have scurvy, say if your gums are totally bleeding, your teeth are loose. That's scurvy. A naturopath would say, well, your teeth are okay right now, but your gums are a little bit puffy, and when you floss, you've got some blood on your tooth, your floss.
Yeah.
You've got a mild vitamin C deficiency. Let's give you a little extra C or have you eat an extra orange every day. In a month or so, your gums going to come clean, when you floss.
Oh,
Okay.
my gums sometimes bleed when I
One
floss.
first thing you do is eat extra oranges or maybe have 1,000 milligrams of vitamin C a day. You try watching about a month, that shouldn't be bleeding anymore.
Hey, you guys heard that? You try watch. You get in the pigeon, huh?
It's it's a trend.
You try watch. Cute.
Osmosis, right.
She, off camera,
been
she
here
said
10
she's from
years.
North Carolina,
Yeah, but I've
but
been here 10
the
years,
pigeon
so
come out. I
A
like
little
that.
bit, yeah. So
So
Let's
so simple things. So vitamin C. I mean, so these are like good advice kind stuff because
Simple
plenty of
stuff.
people no like take medication because sometimes the side effects is worse than the symptom.
Well, now what I do with medication, because I'm also licensed to prescribe most medications, so which also means I can legally take people off medication, which I usually only do in communication with their other doctor because I don't want to be rude.
Yeah.
But a lot of times they'll come in and they'll go, okay, this medication may be saving my life right now, keeping my blood pressure down so I don't have a stroke, for example. But, oh, Dr. Sally, it's making me tired. I've lost my libido. I'm grumpy all the time. My wife and I are fighting. I sleep 10 hours a day. That's the side effects of this medication. Hypertension medications, in particular for high blood pressure, really can do that.
Yeah.
So what I'm going to say is, well, don't go off that medication just yet, because I don't want you to go like this. But let's start giving you these things. Let's make sure you're drinking enough water.
Wow.
If people don't drink 8 glasses of water a day, their blood's going to get too thick. Then their blood pressure can go up.
Oh, how come the blood get
Simple.
thick?
Because if you don't get enough water, like blood is supposed to be fluid, it's supposed to be,
Yeah.
go through quickly.
Yeah.
If it's too thick and sticky just because you're dehydrated, your heart's going to have to pump really hard to get that thick glue-like stuff.
Oh, it
through
sounds
there.
simple, but
First thing we do, guy comes in, high blood pressure, 90% of the time he's drinking 2-3 cups of water a day and maybe a few cups of coffee, okay? If I can get him to drink 8 cups of water a day, blood pressure goes down 5-10 points. He thinks I'm a genius. All I did was tell him to drink water.
wow.
It's amazing how simple these
Yeah.
things can be. It's just doing the doctor thing, the educator thing, reminding people.
You see, and unfortunately, the medical doctors won't. I never, they won't give that kind of advice. Hey, drink more water because that can help your blood pressure go down. Or, hey, you get bleeding gums, have an extra orange a day.
Yeah. Right. It's just a difference in orientation.
I got to bring this up because I just saw it on my iPhone, on my my web. When I go check my email, it came up as a news flash. Marijuana has healing benefits. So
Here we go.
I saw. You practice in Pahoa. Sorry. Oh, shucks. But I don't know. What is your take on that? Does it really have healing benefits, or is it just an excuse for guys to get high?
Well, people like getting high. People enjoy that sensation, and that's not a medical issue. So I put that aside.
Okay.
There are lots of studies on marijuana as, number one, as being a safe herb, and number two, as having medical benefits with lower or much reduced side effects compared to their chemical alternatives. So for pain relief, for example, it's been proven to be less addictive than, say, Vicodin or oxycodone, or those things that we know.
Oh yeah, I know some guys. Yeah, some guys who tell me they get like knee surgery, they took Vicodins and they got stuck taking.
Get stuck taking it.
They should have smoked on joint or something.
It can be useful to help people remember, like the crutch thing I was telling you. If someone has terrible pain and they're addicted to Vicodin, you can't say just stop taking that.
Yeah.
People are not going to listen to you
Yeah.
because pain is a very strong motivator.
Yeah.
Right? So instead we would say, well, let's try these other things to get you out of pain, and that's a viable option for some people.
Oh.
If they're, there's the legal issue too. So
Yeah.
if they're oriented that way that they can do that risk-benefit ratio for themselves, it's an option.
I see.
I have other options too. There are also a lot of herbs that are pain relieving that are legal.
Oh,
So, so like I'm not licensed to prescribe marijuana or recommend it. So that's a whole different issue for me.
Yeah,
So, but yeah, there are lots of studies on marijuana that show that there are lots of health benefits to it.
Oh, interesting. I thought that was interesting. Wow. So the nature path, and the path is what? The path to good health? Or how did that?
Well, I like that better. What it really means is pathology. It comes from pathology.
Oh, pathology.
Which means, it sort of means a natural approach to treating disease.
Okay,
Yeah.
a natural approach. So do you find yourself making herbs, making the la'au, lapa'au,
Have done,
and put it in bottles or I don't know how, or bags?
Yep, pick
Okay.
and dry herbs, preserve them in alcohol. We learned a lot of that in school. Often, actually, in a busy medical practice, I end up ordering them from people who specialize, and that's what they do. So, but yeah,
Wow.
it's really nice if you can go out and pick your own herbs and.
So you must be busy, or too busy.
Too busy.
Yeah.
Well, in a lovely way.
Yeah.
It's always figuring out how many people can you see, and versus time for yourself. Trying to keep that balance. And I try to model that for people because remember that sympathetic, parasympathetic, that nurse your baby or run from the tiger thing.
Yeah.
I always try to go, well, what's the balance for me? And if I can model that for people and stay healthy, then I can maybe teach them how to do that for themselves
Yeah,
too.
yeah, that's my goal.
Yeah,
That's my goal.
that
Since
should
I
be all of our
have
goals.
since I have this show on health, I figure I better start
Stay healthy.
get healthy, and
Mm-hmm.
I developed 4 W's and an R.
What is
One is water.
Water.
I gotta drink more water.
Mm-hmm.
The other is I gotta watch what I eat. I'm trying to stay away from white rice because I tend, because like you said, I'm glad you shared that study.
Yeah.
Because that gets me into the dead chicken mode sometimes.
Yeah. Oh, it does.
Yeah.
We actually say like there's 4 whites that you should stay away from.
Oh, what
I'm
is the
talking
4
about
whites?
food now.
Okay.
Specifically talking about food. Okay. Let me see if I can remember. White rice,
Okay.
white flour, too much commercial processed white dairy as opposed to whole organic or raw dairy. Okay.
I got you.
And what was the 4th one? Sugar, white sugar.
The sugar. Oh, yeah.
Those 4, pretty much nutritionists are just as a controversial field as anybody else, and they all disagree on should you be vegetarian, should you be, should you eat meat, should you eat cheese, blah, 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 blah. It goes on and on. And the problem with it is because, like, one man's medicine and another man's poison. And that's the same with food. There is no one ideal diet for everybody. So somebody comes in with gout, I'm going to prescribe a real specific diet for them to heal. Someone comes in with lupus, it'll be a different diet. Someone comes in with scurvy, it'll be a different diet, right? So, but there are some things that most all health advisors and doctors agree on, and the 4 whites, minimizing the 4 whites is pretty
The
much
sugar, the white sugar,
white rice,
the white rice,
flour,
the white flour, not a
white
processed.
sugar, processed foods, basically.
Yeah.
Yeah.
That's good. So that's my watch. I'm trying to watch that, and then
Yeah.
work out, of course, walk. Get those endorphins going.
That's so smart.
Yeah, and then whisper because I tend to be loud. So that's my other W. And then R is my rest. I gotta get good. I gotta learn how to rest, not just sleep, because I can be like that for 10 hours and not even sleep, but just get good deep sleep.
It's that parasympathetic
Yeah,
thing
get in
again.
that parasympathetic mode where my body can heal. I like that.
Yeah, it's all smart stuff.
Wow.
There's some really good studies on the exercise when you were watching. That's so important because there's some good studies that show that exercise, just 30 minutes a day of exercise, is as good as Prozac for treating depression.
Wow.
As good as or better. than
Wow.
Prozac. Isn't that amazing? But try to get a drug company to tell you that. Nobody, who's getting paid? to
I
tell
know,
you that?
I know.
Nobody's getting paid
Yeah.
to tell you that. So if you can just get out there and do that, you might find everything gets better.
That's fantastic, folks. Wow, man, this is so empowering, to hear you, and,
Right.
and I'm glad folks are there other folks like you, or are you the only
Absolutely.
naturopath?
No. There's a whole, there are quite a few naturopaths in Hawaii, and there's an organization called the Hawaii Society of Naturopathic Physicians,
Okay.
which is online. You can Google it at HSNP.
Okay.
And it has a list of every physician that's in that organization has passed their board exams, has completed at least 8 years of college. I had 12 years of college because I'm a nerd, but, and is licensed to practice in the state. So
Fantastic.
if you want a naturopath in your area and you don't live near Pahoa, for example, you can Google HSNP,
Yeah.
and you'll find some amazing doctors there. And they're all basically.
That's
have
great.
this-
And Dr. Sally is an amazing person. If you're here looking at a person, tight skin, energetic, So, I mean, you can tell she practiced what she preached. So we really appreciate you for being here. And is there anything you'd like to tell the audience regarding your profession, or just staying healthy in general? Any final words?
Oh my gosh, there's so many words. There's so many words. It's
What's the take-home message?
care. The take-home message is care about yourself.
Okay.
Is focus on keeping yourself healthy, keeping yourself in balance, and getting the help you need when you need it. As soon as you recognize a problem, the sooner you get interventions, someone who knows what they're talking about, the better off you are.
Yeah, and be open to different ways of healing.
Open to different ways of healing.
Yeah,
That's
fantastic.
very good. Thank
Hey.
you. Yeah.
And thank you for being here.
very much.
I appreciate you, and
Appreciate it.
thank you, Big Island, for watching. Until then, see you next week. Ahui ho.
Hoo-yah.
On the island, we do it island style. From the mountain to the ocean, from the wind